Focus is brought to you by National Medical Stores, NMS, passionate about your life.
On average, Uganda loses 16 people every day due to malaria. Generally, Africa carries a disproportionately high share of the global malaria burden. In 2019, the region was home to 94% of malaria cases and deaths. Aware of the dwindling malaria funding over the years and now the economic strain COVID-19 imposed to the donor community, donor resources will shift, which may negatively impact on the gains the country has achieved in the fight against malaria. Dr. Jimmy Opigo is the National Malaria Control Program Manager at the Ministry of Health.
COVID also taught us some lessons that countries have to be self-sufficient, have to have resilient health systems. During COVID, everybody learned that all countries have to learn to do things for themselves because there is a lot of competing needs on donor money. The donor countries are having their own challenges, and they are also encouraging us to be able to do a few things for ourselves.
But Dr. Opigo believes it's time for government and society to step in and bridge the gap leading into self-reliance.
The country has been responsible for the platform on which we run the malaria programming. The country had worked on making sure that we make our medicines within the country. We are also working on making our own mosquito nets. But beyond this, also we had moved on making malaria supplies tax-free.
While officiating at the day's commemoration today, Minister for Health Dr. Jane Ruth Acheng on the sidelines said they are now targeting a multi-sectoral approach towards domestic financing.
It's been increasingly adding resources for malaria. Next financial year alone, the government has provided an extra 50 billion to support the response to malaria. So the Ministry of Health has partnered with the private sector to mobilize resources to support the 4 different interventions that we are currently implementing. And that is the indoor residue spraying, the bed nets, the insecticide-treated nets, larviciding, and test, treat, and track. There is no one intervention that can work alone.
However, Dr. Opigo says they still face a number of challenges.
West Nile for a long time grew tobacco and cotton and heavily used chemicals. Now these chemicals have exposed the mosquitoes in that area and they have developed some resistance. So we are working on how to change the type of nets we are going to deploy in West Nile. Urban populations, we are becoming non-immune. So whenever we travel up country, either on business or vacations. So we need that awareness of now travel health coming up. That is one new thing. 2, again, in urban malaria, there are pockets depending on the neighborhood. So we'd like now to target like the slum areas where housing is a problem. Again, there are areas where there is cattle keeping and acaricides being applied on this cattle. We would like to work with agriculture to see how we leverage on that. Like the heavy cattle farming in Ankole has enabled us to bring malaria down there, plus other socio-economic things, including housing in that place.
We are targeting the young generation to solve the societal challenges using the knowledge they get from school, be it in environment, be it in the health, like fighting malaria and nutrition. So these are scientific messages that we have been learning in school, but we stop at only passing examinations using that knowledge. But we want that knowledge this time to be transferred from school, from the 4 walls of the classroom, to solve our societal challenges.
Globally, the elimination net is widening, with more countries moving towards the goal of zero malaria. Malaria elimination is defined as the interruption of local transmission of a specified malaria parasite species in a defined geographical area as a result of deliberate activities.
We have made huge strides in combating this global killer. But lately, progress has plateaued, particularly in countries with a high burden of disease. We have missed critical targets of the global malaria strategy. At the same time, we have made great strides, with many nations now on the road to eliminating malaria. 24 countries have succeeded in reaching zero malaria transmission for 3 years or more, and in total, 38 countries and territories have been certified malaria-free by WHO, including most recently El Salvador, Algeria, and Sri Lanka.
Last year, we announced that malaria fell from 19% to 9%. With the mosquito net distribution, we have just looked at the data. The routine cases we have been having have dropped by over 30%. We have set to come to 5% by 2020.
Households in Uganda spend an average $9, approximately 35,000 shillings, on treating malaria every year. Calculated in terms of productivity, an adult loses about 3 working days and children spend up to a week nursing the disease. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.